This may surprise you, but one of the top predictors of health outcomes is the quality of our social support networks. Social supports are the people who bring us crutches, drive us to the doctor, call us after a hard day, but they're also our schools, work, and church. Together, these make up our whole network of support. For some people, that's 10 others. For others, it's just one person, and for some, it's no one. The problem is these networks are invisible to the people who care for us, like our doctors, therapists, and other providers, making it almost impossible for them to know the risks that a person faces by being socially isolated. But imagine if there was a technology that could make it easy for a provider to talk to a patient about their social supports, find the gaps, and create a care plan to fill them. At Visible Network Labs, we are a group of data scientists using unique methodology and data visualization to do just that. I'm Danielle, CEO and co-founder of Visible Network Labs. Thank you. I started my career at the Rand Corporation as a policy scientist and spent 10 years at the University of Colorado, Denver as a professor studying the connection between social support and health outcomes. My team and I made a lot of important discoveries, which we turned into technologies that people can use. We validated that people will pay for them and they work in the workflow. We've won some awards. And we've even published over 30 papers on the impact of our data and technology on patient and system outcomes. And with investments from the Robert Wood Johnson Foundation, one of our technologies is in 2,000 communities across all 50 states, generating a proprietary data set of over 60,000 organizations and the links between them. But we have a whole suite of technology that people use. And we're being inundated with requests for systems integration from new and existing partners. That's why we created Aspen, a comprehensive platform with all the tools, technologies, and services that a person needs to make sure no one is without a social support system. So this is Claire. She's a woman with advanced cancer. Last time she went to the doctor, she told him she was starting to have trouble feeding herself, taking care of her grandkids, and getting to her appointments. Not surprising, he asked her if she had anyone at home to help her. And like most of us, she said yes, even though she's mostly alone. And why does this matter? Because these are her social determinants of health. Researchers at Kaiser found that women with cancer who were socially isolated have a 40% greater chance of recurrence, a 60% greater chance of death by cancer, and a 70% greater chance of death from any cause than women who are more socially integrated. And yet, her doctor has no tool to get under the surface of this and create a care plan to help her, understanding the risk that she faces by being alone. But Aspen changes all of that. We make it easy for people to talk about social support and doctors to find the gaps and create care plans. Let me show you how it works. So after a patient is given a tablet or a phone, they answer a few questions, including the things that they're most struggling with. They can list who helps them with the things they need, and after just a couple of swipes, we can see if those people are connected to one another and if any of them are helping them with the things they need. In just a matter of minutes, we can find if a person is embedded in a coordinated system of care, or in Claire's case, when they're not. And providers can use that information to create care plans for people. Using our machine learning and proprietary algorithms, Aspen will comb through our data set, link with other data sets, and create a care plan for a patient that can fill the gaps where an informal support can't, looking for a coordinated group of organizations to provide that care, creating a whole network care plan for that person. And Aspen makes it easy for people to use that data in their organizations. Every time a person is screened, the data go into the database, and the data go into the database, and a provider, a whole network of providers, or a whole health system can use that data to identify trends and at the individual, organization, and population health level. And when we do that work, We can increase patient satisfaction and safety, improve provider efficiency, and improve whole health system costs. But there's even more. When strong social support systems can prevent chronic disease, increase life expectancy, improve cardiovascular health, and reduce hospital readmissions. So let me tell you a little bit about our company. We already have 2,500 paying customers. And over 600 people have paid to attend our trainings to learn how to use our technologies. And some are here today. And our newest features are already being piloted in 5 sites. And we have a growing community of connected users. Our company models the values of trust, shared learning, and collaboration. Our customers don't just buy our products, they attend our events, they connect with each other, and they share findings to improve overall patient health. We're going to leverage that community as we transition those customers from single feature users into whole Aspen subscribers. We're already in the $90 billion care coordination industry and the $200 billion mental and behavioral health industry. And we aspire to be in 3 of the top 10 health systems in just a couple of years.
Are you pro-single payer?
We are, you might be wondering how the heck we're going to do all of this. Rest assured, we have the strongest team and social support network possible. Our team has worked together for over 10 years, and we are veterans in network science, product development, and business leadership. Our network of mentors and advisors are strong in product and technology, business leadership, and marketing and branding. And those folks are here today, too. And our whole network of connected communities. But it doesn't stop there. We have dozens of partners at the local, state, and national level who are working with us to tackle one of the most difficult issues in healthcare today, social isolation. As I was getting this ready, this came up into my news feed, and this stood out. Loneliness is deadly. Our company is doing everything we can to make sure that no one is left alone. We believe that supportive connections are rooted in, we believe that health and well-being are rooted in supportive connections. And that together, our platform, our team, and you, that's Aspen.